So we're going to be exploring more of this throughout the hour, and we thank you for tuning in to WTVI's HealthWise tonight. We're looking at natural options of treating ADHD and hyperactivity. As far as ADHD, that is a type of depression?
No. I brought both of these into the same
topic here.
Thank you. Because there are areas that are common between them, and you'll see this later in the show, hopefully, as I have the opportunity to explain the links that are causing actually a spectrum of neurobehavioral disorders, and the research is confirming that at a higher rate each year.
Okay, well, let's continue with the slides that you brought us, and some of these are going to be quite technical. I know they're hard to read at home, ladies and gentlemen, but Dr. Speight's going to explain to us why they are significant and what he wants to get across here.
You know, one of the things that I like to do with my patients is to empower them to take care of themselves, within reason, of course. And it helps if you understand a little bit about the physiology of your disease. And this slide, what we're trying to show, and it's not exactly, both sides of the slide should be white, but basically, on the left-hand side of the slide, L-tyrosine is the base amino acid that is used to create dopamine, norepinephrine, and epinephrine. These are what are known as catecholamine neurotransmitters. They give you energy and help you bounce and keep you focused. On the left-hand side of the slide, you see in yellow what are known as cofactors. They work with enzymes to actually produce the next neurotransmitter. Without them, the rate of that reaction is very slow. So, if the theory is true that we're missing neurotransmitters or the levels in the nerve synapses are low, by optimizing your amino acid building blocks and your vitamin cofactors, you ought to be able to help generate more of that neurotransmitter. And that's the take-home message of this slide. On the left hand, we have tyrosine. On the right-hand side, we have tryptophan, which is the base amino acid that's used to create
And unfortunately, it doesn't show
it doesn't show.
Okay, so basically the message here is the neurotransmitters.
Yes, the message here is that let's optimize your ability to produce your own neurotransmitters, and I'll show that in a little more detail in the next.
Let's just continue on with the slides. Now, this looks like a brain.
This is a brain, and in the top half of the slide, we see blue pathways that represent dopamine, where dopamine works in the brain, to help facilitate memory, motor actions, its involvement in addiction and motivation as well. The bottom half of the slide is showing the distribution of serotonin in the brain. And I wanted to bring home the fact that these neurotransmitters are very influential over the entire brain.
This is where they work in the brain.
That's right.
All right. Next slide.
There are other neurotransmitters in the brain, but two of the other primary ones are glutamate and GABA. Glutamate works as the gas pedal of life. GABA is the brake pedal, so to speak. Over 50% of the neurons in the brain actually release glutamate, and about 40% of them release GABA. Glutamate is important for proper learning and focus and motivation. GABA helps calm you down. Interestingly, glutamate is elevated in the presence of caffeine, GABA in the presence of alcohol, and drugs like Valium or Klonopin.
Interesting. So that's how we make sure that everything's balanced?
Well, to some degree, yes. I mean, the catecholamines, dopamine, norepinephrine, and serotonin they balance each other as well, but these are two other neurotransmitters that are important in solving some of the issues surrounding depression, anxiety, and attention deficit. So we need to look at those as well as the first sets of neurotransmitters that we showed there.
All right. Next few slides here to go through. It'll be coming up in just a second here. All right. Once again, hard to read, but why is this significant?
Actually, that's the same slide.
All right. Let's go forward, guys. Yep, here we go.
The next two slides are just to summarize the different types of neurotransmitters and what high levels versus low levels in the body can do. We talked about GABA briefly and serotonin. Two other neurotransmitters, which are actually amino acids, are glycine and taurine. All of them have calming effects generally, unless they're present in extremely high doses, and then there's a paradoxical hyperactivity in some cases. In extremely low levels, they can be associated with hyperactivity, low mood, uncontrolled anxiousness, and trouble sleeping. So I'm trying to give people a flavor of...
I understand. And if some of these are off kilter in my body, is this where medication comes into play?
Yes.
Or certain foods come into play?
Well, medication can come into play, but you can also manipulate these by giving the building blocks that they're created from. And that's the take-home message of the slides. And we'll talk about how to do that a little further in the show.
Okay, well, let's go right on and make sure that we fully understand what we're talking about here.
This is an illustration of how the neurotransmitter actually works. You have what is called a presynaptic cell and a postsynaptic cell. These are neurons that are present in the brain and in the periphery of our body, in the gastrointestinal tract, etc. They are producing neurotransmitters, releasing them into that gap in between the two nerves, and they bind to the other side of the nerve and then bounce off, if you will, that nerve after they've achieved what they were going to do, and they're taken up by what's known as a reuptake transporter, taken back to the presynaptic cell, broken down, and resynthesized again. The medications in the body actually block their reuptake, Prozac, Zoloft, etc., and keep them out in the nerve synapse longer. And that works initially. The brain thinks it has more of the neurotransmitter. The problem is if you're not supplying the building blocks you need to make more serotonin or more norepinephrine, dopamine, etc., then you can't sustain that, because if you'll go to the next slide, there are enzymes in the synapse in between the two.
You'll be there in just a second. And that was going to be my next question. How do you maintain that building block?
Well, you have to give those base amino acids, but the highlight in green represents an enzyme that actually breaks apart the neurotransmitter in the synapse. So if it's not taken back up and properly broken down and resynthesized, then it will be broken down there in the synapse. So if you block one half of the equation without supplying more neurotransmitter, eventually all you have is broken down neurotransmitter in the synaptic cleft. And thus that depletes you of serotonin, of norepinephrine. And that's why the medications are only part of the solution. I had a woman who I had placed on Zoloft at 50 milligrams. We increased her dose to 100 when she started having trouble at 50. And that worked for about 6 months, and then we had to go up again. And eventually she started experiencing side effects from the medication, and the medication didn't work anymore.
Was this for ADHD?
No, this was for depression.
Depression.
But the same can apply for ADHD. And she came in one day crying, just miserable with the side effects and the fact that she was depressed yet again. And so I said, let's try adding amino acid support to what you're doing. And within about 45 days, I had her dosage of Zoloft back to 25 milligrams, and she had no side effects, and her depression was completely under control. And it was because we used a small amount of amino acids to help support her production of neurotransmitter.
And what would have happened had you not had this intervention?
Well, I would have had to switch to a different drug, and we'd actually already tried two.
Because at that point, she's in that holding pattern where it was just not working for her?
Yes, and I believe the neurotransmitter was being degraded in the synaptic cleft. Now, you have to be careful. I don't recommend that people go and do this on their own because you could theoretically create what's known as a serotonin syndrome, where you give yourself too much base amino acid, and then in the presence of the medication, it could cause an excess. You could get heart palpitations and blood pressure problems related to that.
And is that why when we talk about depression and ADHD and the treatments of, it can be so controversial? Is this one reason why it can be?
Yes. In fact, there are physicians who would probably say, no, don't do this.
Yeah.
And again, part of it, if you look in the PDR, the physician's desk reference, about half of the drugs in there, they don't even know what the mechanism of action of the drug is. Now, they've done safety studies and they've tested the medication, but they don't completely understand why it works. And so there's room for controversy. Amino acid therapy is being studied. There was a study out of the University of Minnesota recently showing how urine neurotransmitters are influenced by urine neurotransmitter levels are influenced by amino acid levels. So there's research going on showing that this has a benefit, but it's not easy to tease out all the answers.
How do you get the amino acid in your system?